I am Dr. Raj Harjani. You are watching me on Sify.com.
What precautions should HIV-infected patients take to prevent its transmission to others?
This transmission rate is reduced by 96% if the HIV positive patient is taking antiretroviral therapy regularly. And if he uses condom, then he is not going to transmit the HIV to the uninfected partner. But you never know, sometimes condom breaks or it is spilled. Then the best is to give a post-exposure prophylaxis to the uninfected partner. So that is a precaution that patient of HIV has to take, that when he takes antiretroviral therapy, then he has to monitor his viral load status. If the viral load is under control, he is not going to transmit the disease to HIV negative partner. And second thing, if he has got a sexually transmitted disease, he has to take the treatment of STI, and otherwise it is not transmitted by just kissing, hugging, masturbation or mutual masturbation. So, or sharing the utensils, eating together, swimming, working together, it is not transmitted. So the best is only take ART regularly and condom uses. That's the main thing to prevent the HIV transmission I will recommend.
What guidelines can help HIV patients to improve their health?
There are not any guideline that patient should take to improve their health. But the main thing is that when patient approaches a HIV specialist, he has to listen to a HIV specialist properly, and if the HIV specialist is taking keen interest in his questions and answering him properly, clearing his doubts, and he develops trust in the doctor, then he should continue with the doctor. Otherwise, a busy doctor will not solve his problems. So the best is he should approach the right doctor and develop a faith in him. Whatever he says, he follows that, takes the ART, do not discontinue the antiretroviral therapy, monitor the HIV status and CD4 from time to time as recommended by doctor, and then that is the main thing. Apart from that, if he is taking good sleep, then good nutrition, exercise, yoga, meditation, avoidance of tobacco, alcohol, I think all these things are going to make a lot of difference in HIV positive patient's life, and he can spend a near normal life, and his quality of life will also improve. I'll again request all the HIV positive people that when you visit doctor and you develop trust in the doctor, please do not go to another doctor and change the medicine. If you change the medicine, then there is a likely that whatever medicines are available, whatever regimes are available, that will get exhausted in a few years, and you have to lay around 30 to 40 years on antiretroviral therapy. So frequently changing of doctor, frequently changing of regime is not recommended. Please make a note of it.
How can we all work towards the prevention of HIV infections and AIDS?
Lot of time it was discussed by most of the politicians and the great people that there is a ABC that we can prevent the transmission of HIV. That is A stands for abstinence in young people, that they should not do sex before marriage, and be faithful for those people who are married. They should not go have extramarital exposure to anybody, and C is a use condom. I will define the sex like that sex is a element force in the life. Nature's mighty urge for sex is stronger than fear and hunger. Life without the spice of sex is like an insipid goa curry without coconut or condiment. And sex is a sign of vibrant health. So looking at this definition, I cannot resist by saying that abstinence and be faithful will not work. So sex is going to be there. It's a part of life. Everybody is going to enjoy. So the best is to give education, sex education to the youth, sex education to our colleagues, sex education to our seniors who are divorcees or widowers, like solo living people, that you can do sex, no doubt about it. You can do sex, but do sex with certain limitations, that use condom, because condom gives 100% protection. No sex, no HIV. Sex means risky. Whenever somebody does a sex without condom, it is highly risky. So it is always have a sexual health. You should remember that when you are going to do a sex with anybody, whether it is an acquaintance or known, it is better to do a sex with condom. Then if you got STI, sexually transmitted infection, it is better get it treated, because that is a gateway for acquiring HIV infection. And once somebody has got a knowledge that he has been given a blood transfusion, or he has taken intravenous drugs, or he had a sex outside, or sometimes without condom, then it is better to get tested for HIV periodically. And suppose somebody has made use of a condom and it is broken or spilled, the best is to take a post-exposure prophylaxis. That is a 1 tablet ART in a different manner it is available, different combination it is available, that is to be taken within 3 hours or maximum in 3 days time, so that HIV transmission does not occur. And those who are the people who are uncircumcised, if they circumcise the foreskin of the penis, then probably HIV is not going to remain there in the fold of the prepuce. Or there are many CD4 receptors. HIV is not going to attach to these receptors once the skin is removed, like Muslims do it. And if somebody is willing to go for a date with somebody else, then take a antiretroviral therapy as a pre-exposure prophylaxis. So these are the ways we can reduce the transmission rate of HIV in a society. And those who are HIV infected, test and start antiretroviral therapy. As I already said, that 96% reduction rate is reduced.
Yeah.